Today I hope to give you some real insight into fibromyalgia. I believe that you'll get your greatest insight into fibromyalgia by simply understanding the proper definition of the word syndrome. Remember, this is fibromyalgia syndrome. And a syndrome is really a number of symptoms that can occur together. Many diseases can cause the same syndrome. Let me say that again. Many different diseases can cause the same syndrome. Remember, you've been given a diagnosis of fibromyalgia syndrome. For example, fever and a sore throat is a very common syndrome. It can be caused by diseases as different as bacterial pharyngitis, the flu, and cancer of the larynx. As you can see here, we have three completely different diseases that cause the same syndrome. Again, we have three different diseases causing the same symptoms. So in order to resolve this syndrome of fever and a sore throat, you'd have to address each of these three causes very differently. You don't address the flu the same way you would address bacterial pharyngitis. Of course, you wouldn't address cancer of the larynx the same way you would address the flu. These completely separate diseases or conditions are causing the same or very similar symptoms. Now, for each of these three diseases, the road to health would be completely different. Now, to more completely understand fibromyalgia syndrome, let's again look at a completely different condition. It's called carpal tunnel syndrome. The symptoms include tingling or numbness in the fingers and weakness of the hands. So, carpal tunnel syndrome is due to excessive pressure on your wrist and the median nerve, according to the Mayo Clinic. The most common cause of this inflammation is an underlying medical condition that causes swelling of the wrist and sometimes obstructed blood flow. Some of the most common conditions linked with carpal tunnel syndrome are, and you wouldn't necessarily think of these relating to the carpal tunnel, which is the wrist: diabetes, thyroid dysfunction, fluid retention from pregnancy or menopause, high blood pressure, autoimmune disorders like rheumatoid arthritis, fracture or trauma to the wrist. So lifestyle factors that may increase the risk for carpal tunnel syndrome may include smoking, high salt intake, sedentary lifestyle or lack of exercise, and a high body mass index or obesity or being overweight. Carpal tunnel syndrome can be made worse if the wrist is overextended repeatedly. Repeated motion of your wrist contributes to swelling and, of course, compression of the median nerve. Now, many people have these exact same symptoms for a variety of different reasons. You got to get that. Many people have the same symptoms for a variety of different reasons. You can apply this same concept to fibromyalgia, and you have to apply this same concept to fibromyalgia. What's the concept? Many people have the same symptoms for a variety of different reasons. These people that we're speaking of currently have carpal tunnel syndrome for a variety of different reasons and a variety of different underlying predispositions. So for one person to solve the carpal tunnel syndrome problem, they may have to change their occupation to one that does not have repetitive motion. Yet some can resolve the syndrome by addressing the predisposing factors like diabetes, being overweight, addressing their thyroid condition, not smoking, reducing your salt intake, and starting to exercise. So as you can see, again, the pathway to healing is potentially very different for each individual. So if you're going to understand fibromyalgia, this concept is vital. Now, in the same respect, those of you who have fibromyalgia syndrome share many common signs and symptoms, yet you have a variety of different predisposing factors, as well as many different previously diagnosed or even undiagnosed conditions, as well as different lifestyle choices that have led you to be diagnosed with the same syndrome. I'm hoping you can now see why some of your friends in the fibromyalgia forums may have similar symptoms, yet different underlying predispositions and aggravating factors. Now, I can verify this with my personal clinical experience that the road to health for each person suffering with fibromyalgia syndrome can be very different. That's why there will never be a single pill that will cure fibromyalgia. Now, from a functional medicine perspective, we don't treat the disease, we treat the person. We do a complete medical history, a lifestyle analysis. We use metabolic assessment forms to give us insight into each individual patient. We use this information to determine what advanced testing might be necessary. Once we gather that information, we design a treatment protocol specific for each person. With what you've just learned in mind and the examples that we've used in mind, let's look at fibromyalgia. Now, according to the Mayo Clinic, the symptoms of fibromyalgia might include widespread body pain, fatigue, and cognitive dysfunction. Now, you and I know that this is just the tip of the iceberg. Fibromyalgia often coexists with other painful conditions like irritable bowel syndrome, migraine, headaches, or headaches in general, interstitial cystitis or painful bladder syndrome, and temporomandibular joint disorders, TMJ. Now, doctors don't know what causes fibromyalgia, but they say it most likely involves a variety of factors working together. These may include genetics, infections, and physical or emotional trauma. Risk factors, of course, are your sex. Women are much more likely to get fibromyalgia than men. Family history. Did anyone in your family have fibro? And other disorders which you might make note of, like osteoarthritis, rheumatoid arthritis, or lupus. If you've had those, you may be more likely to develop fibromyalgia. This comes from the Mayo Clinic, so it is strictly from a standard medical perspective. Now, if we look at fibromyalgia the same way we looked at carpal tunnel syndrome, we realize the way to reduce the symptoms is by addressing the predisposing factors, the risk factors, and the associated disorders. So you can see from what I just mentioned that there are things that you can't change, like your genetic predisposition or your gender. From a functional medicine perspective, which is what I have seen in a clinical setting for the last 10 years plus, and then many of my colleagues can concur from a functional medicine perspective, the risk factors for fibromyalgia and might include, but not limited to, obesity, diabetes, autoimmune conditions like lupus, Hashimoto's, Raynaud's, rheumatoid arthritis, food sensitivities like gluten, corn, dairy, soy, just to name a few, pathogenic bacterial infections, opportunistic bacteria, bacterial dysbiosis, small intestinal bacterial overgrowth, fungal infections like candida, even parasites. So, in order to help patients suffering from fibromyalgia syndrome, we have to gather the appropriate information in order to address both the predisposing factors and the underlying condition, as well as aggravating factors. The good news is that when you understand what a syndrome is, it enables you to address the underlying cause of the syndrome to restore health and wellness. My hope for you today is that by properly understanding the definition of a syndrome, you recognize that there is a variety of different predisposing factors, underlying conditions, and aggravating factors that come together to form this syndrome. As we uncover and deal with each of these overlapping issues, the symptoms that make up this syndrome get better and normally resolve. The first step is to discover your predisposing and aggravating factors as well as your underlying conditions. Step 1 is what we call discovery. Step 2 is treatment. Once you actually discover these underlying issues, treatment is much more obvious and straightforward. So I hope that this has been of help to you. I really do want you to get your life back. I want you to achieve your purpose and reach your destiny. If this information has been helpful, I've developed a website called Fibromyalgia University. There is a ton of information on there. I invite you to come and take a look around. It is free. It will cost you nothing. It is www.fibromyalgiauniversity.com. Thanks so much. Have a great day.